So today we are gonna discuss a layered case in homeopathy. Actually, I wanted to upload the video of the patient, but it would be unethical without approaching or without asking the patient. So I am discussing the case here. There is cases, or there are some cases which are only curable, or they only get cured by removing the layers of their disease. So this is the case I found, very much informative for the people, for my viewers. This was the case, a male aged about 45 years. So the first complaint of his was that he had the anxiety, never resting in one place, like sitting from one bed to another, from one chair to the another chair, and asking for water, and very much contemptuous. So this was the first symptom or first symptomatology. So based on the mental symptoms, he has or he had the fear of blood, he had the fear of injections, he fainted over seeing the blood, or over seeing the injection, or even some blood, or anything which has the accidental situations, he would have fainted very easily. So this patient, very nervous, very much anxious, and when I interviewed him, he told me that he has the attitude of miser personality, not compromising with health, not compromising with money. So based on these symptoms, I prescribed arsenicum album 200 c single dose. So after 2 months of this dose, the patient came to me and said that I am feeling much relaxed. The hypertension, the anxiety, those issues are not there. But after 4 or 5 months, the patient became alcoholic, and he started abusing his family, uh, by mean of abusing mean verbally abusing, and it happened only after consuming alcohol. So after asking the patient whether he feels his collar tight over his neck, whether he feels some poison sensation, that there is poison in my body, and also there is loquacity in the patient after drinking alcohol. If we search the repertory, loquaciousness, intoxication after, there are tremendous remedies like lachesis, like hyoscyamus, arsenicum, like stramonium, like opium, like veratrum. But the peculiar in this case was the jealousy, the typical jealousy of lachesis. The patient started uh, calling his relatives and started abusing them about their wrongdoings, about this, about that, being jealous. He also uh, did some abusive behavior with his family. So I gave Lachesis 200 c single dose. For 1 week he was quite well. Again the symptoms followed. Again I have prescribed Lachesis 1 m single dose again, and the patient completely left the alcohol. You won't believe it. Yes, the patient uh, got cured by the disease or the craving of consumption. So this was the second layer which came in this case. Patient improved a lot, eating behavior also changed, the behavior, the psychology also changed. But after 1 or 1.5 month, the patient went into the epileptic fit. He had the attack of epilepsy, and he visited the conventional or the modern medicine doctor. Doctor prescribed him medicine for epilepsy and for bipolar disorder. So what I have observed in this case at this time, that the patient was uh, losing the thread of conversation. Like he was conversing something. I asked the patient, what is happening, how you are feeling right now. So the patient said, I am good, and then he talks the other things, about other things. So I was a bit confused whether to give lachesis again or to give another remedy as the situation called. As as in past also, when he was very young, he had these problems of fainting by seeing blood, by seeing the injection. The fear of injection was there. So this patient actually went back to the symptomatology. This is the beauty of homeopathy. When you clear one layer of the symptomatology, the previous layer or the previous symptoms in the case come out again, and you clear those symptoms. Then if any diseased conditions remained before in the past, so few symptoms of them come, and they come very forcefully, like those fainting spells. Patient himself had those fainting spells, not uh, seldomly, but uh, not on regular basis, but whenever he saw the blood or the dead body or the injection or the injury to himself, whenever he sees the blood, he had this anxiety, this fainting spell. So a normal homeopath would think of nux moschata or arsenicum or platina maybe. But no, the third remedy was medorinum. Why medorinum? This is the beauty of homeopathy. I have chosen two symptoms only. The first symptom was losing the thread of conversation, and the second symptom was clearing the throat. When you read the desktop guide to um, the desktop guide to homeopathy by Roger Morrison, he has given the symptom in the materia medica of this desktop guide, that people with medorinum personality, they have prosperity to clear the throat every time they speak, or they usually clear the throat. So there is phlegm or anything in their throat, mucus, anything, I don't know, but I have seen lot of cases with medorinum. They have prosperity to clear their throat like this. If you see any patient with this symptom, think about medorinum, but the other symptoms should have also be matching with the case. So I have given medorinum. uh, Patient, within 2 days, patient came back to normal life, not behaving insanely, not losing the thread of conversation, but the anxiety is still there. It will go by the second dose of the same potency of medorinum, or the potency should be risen, so that patient feel relief. So this patient is almost 80% cured right now. So there is this case who shows us that there is the diseases which come in layers in homeopathy. If we study cases deeply, if we study symptoms deeply, we not only catch the remedies very easily, but also the essential features of the remedy. For instance, if you watch my video again and again, you will find that only few quite strong keynotes, few strong symptoms can lead you to the right remedy, and only right remedy can cure in homeopathy. Bogus bogus homeopathy or anything which is impractical, which is theoretically not possible. People are doing it. Polypharmacy, giving 10 to 12 remedies, giving remedies day by day on daily basis. They are people who are just ignoring the basic of homeopathy. They are ruining homeopathy. I am here to help the people to find the correct way of homeopathy. So you should give something back to our great founder of homeopathy, Samuel Hahnemann, because that person has given tremendous knowledge, tremendous therapeutics of alternative medicine to the humankind. So please be careful about your studies in homeopathy. Uh, this is the area of focus of the patient. Mental health of the patient, of course. Fears and phobias are most important. If you see the fears and phobias of the patient, there is no repertory which has medorinum in it. This is the beauty of reading many authors like Kant, like George Withulkus, uh, Morrison, like for instance Dr. Farouk J. Master, for instance reading some old masters like Boyrike, Clark, or even the Ellen Keynote, C.M. Boger. You should you should bridge the gap between these modern great homeopaths like Professor George Withulkas and these old authors, old physicians of homeopathy like Kent, like J.H. Clark, Boyrick, C.M. Boger, Allen. So these people, Dr. S.R. Phatak, he was a tremendous homeopath with the knowledge of modern medicine. He was a modern medicine doctor, but turned into this profession of homeopathy. So, what is the summary of the case? Summary of the case is that homeopathy is a bliss in cases with chronic symptoms and case of deep pathology as well as acuteness in between. See, homeopathy does not work if you are not willing to catch the essence, the essential feature of the patient. For instance, in coma cases, people generally think of coma remedies like zinkum or like other remedies, but we ignore the constitutional makeup of the patient. Or if the coma condition came suddenly, there is acute flare up, or if this condition is new to patient, there are lots of stuff, there are lots of things to learn with the practice. If you sit next to the prescriber, the classical prescriber of homeopathy, he or she will tell you that do this and don't do this. Bookish knowledge always won't work in cases, and always practical knowledge doesn't lead you to the simillimum or the homeopathic right prescription or the right remedy. It is you who should have to choose the symptoms accordingly, because books tell you, the repertory tell you that these symptoms have this remedy or that remedy or these remedies, but sometimes symptoms are just pseudo symptoms. The person behind them, who is he, who is she, what the person or what the patient tells us, because homeopathy is to treat the human, treat the person, not the symptoms, or sorry, not the disease. We are treating not malaria but the symptoms behind malaria, the sensation of the patient, the fear, the phobias of the patient, the food cravings of the patient, where they lead us to. Sometimes food cravings also doesn't help, because there are many general remedies for sweet craving or sour craving or craving for salt, but the person behind them, the mentality of the person, that is the stuff that works in homeopathy. You won't be successful in homeopathy uh, if you do malpractices in homeopathy. Thank you very much. Hope you will learn from this case that how arsenicum lac acid followed by Medorinum cured, completely cured this patient. This patient is all right now, and he is enjoying his life very fully. uh, Anxieties are almost gone, 80% cured in the anxieties and all the stuff. So if you want to presence homeopathy in this world, if you want to make homeopathy work for every person, you should have this knowledge, the grasp of the subject. It won't lead you anywhere if you malpractice, if you do not do wise things in homeopathy. You should have to work hard, you have to read, you have to study, you have to follow the masters, you have to do lot of stuff to conclude the cases. By directly seeing the patient, we know that what is the remedy of the patient, but to achieve that level we have to work hard. Thank you so much. And I am requesting to all the people whoever watching this video to please subscribe my channel to get new updates on homeopathy. And if you enjoyed the video, if you learned something good, something new, please share the video, like the video, subscribe my channel. Thank you very much.